I'm honored to have you here today. I'm here with Dr. Stella Michaelidou, who is the president of the National Committee on Environment and Children's Health since 2004 of Cyprus. She was appointed by the Cyprus Council of Ministers, former acting permanent secretary minister of health, and director of the State General Laboratory of Cyprus. Cyprus has a nationwide campaign on how to reduce wireless radiation due to the Cyprus Committee bringing this forth. There's clear guidance on how to hardwire computers for children for distance learning during this pandemic, which I hope we'll talk about. And the Cyprus National Committee on Environment and Child Health has also worked, and what we're going to talk about today and premiere is a short video showing how Wi-Fi was removed from the pediatric units of the Archbishop Macarius Hospital. And I'm also going to be playing some of the public service educational campaign videos that the committee has created and that have been translated into English. I also
hope other languages. In many other languages, yes. Already, a friend from Bettina saw her. Yesterday I saw her. I don't see her now. She's translating them to German. And we have translation in Israeli, in many languages. They contacted us, and of course we gave our permission to use these videos. It's no problem.
So in the chat, by the way, people are asking, can we translate into our language? And I will follow up with them and connect you with them. I would love for you to introduce this video, and then I'll play it. I'll share my screen. Could you tell us about why you made it and what we're about to share?
Why we made it? We believe very much that videos are strong instruments in influencing the people. One photograph is equivalent to many pages of written suggestions. So we decided to invest on videos, really. And I would say also that we have an excellent producer in Cyprus, which is Miltos Hadjoulis, who the first video, I really was made with 2,000 euros only because I didn't have more money. And I go to him and he said, okay, don't worry, we manage and we produce the film for you. So since then we cooperate with him, of course, and we issue all the videos. So, if somebody wants to translate in his own language, he can contact me on my email. And of course, we can provide them the file and they can translate. We have certain rules in relation to that, but I can explain them in the video. It's no cost at all, but they can contact me and everything else can be done. It's not a problem.
Στο Μακάριο νοσοκομείο προφυλάσσουμε τα παιδιά από την ακτινοβολία της ασύρματης επικοινωνίας, ιδίως των κινητών τηλεφώνων και του Wi-Fi. Ο Παγκόσμιος Οργανισμός Υγείας το 2011 κατέταξε την ακτινοβολία αυτή ως πιθανώς καρκινογόνα για τον άνθρωπο. Σύμφωνα με νεότερες επικυρωμένες έρευνες, η μακρόχρονη έκθεση στην ακτινοβολία αυτή είναι πιθανό να προκαλέσει και άλλες σοβαρές επιδράσεις στην ανάπτυξη και λειτουργία του εγκεφάλου, του αναπαραγωγικού, του ανοσοποιητικού και άλλων συστημάτων του εμβρίου και του παιδιού. Να προκαλέσει καταστροφή των νευρικών κυττάρων και του DNA, διάσπαση της προσοχής, διαταραχές στη μάθηση και άλλες νευρολογικές παθήσεις. Τα παιδιά και τα νεογνά, ιδιαίτερα τα πρόωρα, είναι πολύ ευάλωτα και πρέπει να τα προφυλάξουμε. Γι' αυτό, βασισμένοι στη διεθνώς αποδεκτή αρχή της προφύλαξης, στους αλάμους εντατικής θεραπείας παιδών και νεογνών του Μακάριου νοσοκομείου, αποσυνδέσαμε το Wi-Fi. Χρησιμοποιούμε μόνο ασφαλές ενσύρματο διαδίκτυο, συμβουλεύουμε όλους όταν πλησιάζουν τα παιδιά να βάζουν τα κινητά τηλέφωνα τους σε λειτουργία πτήσης. Έτσι, φωτογραφίσουν και διασκεδάζουν τα παιδιά με μουσική και βίντεο, χωρίς να τα εκθέτουν σε επικίνδυνη ακτινοβολία. Γιατί τα παιδιά έχουν δικαίωμα στην υγεία.
Η υγεία είναι δικαίωμα. Είμαστε στερείτε.
Είμαστε περήφανοι για την πρωτοποριακή αυτή έρευνα που γίνεται με την επιστημονική καθοδήγηση και συνεργασία της Εθνικής Επιτροπής Περιβάλλον και Υγεία του Παιδιού. Καταφέραμε να μειώσουμε την έκθεση στην ακτινοβολία σε αποδεκτά επίπεδα ασφάλειας και θα συνεχίσουμε.
Μαζί δείχνουμε το δρόμο. Και το Μακάριο Νοσοκομείο εξελίσσεται διεθνώς σε μια πρότυπη όαση υγείας και προφύλαξης των παιδιών από την ακτινοβολία. Γονείς, μάθετε και εσείς πώς να προφυλάξετε τα παιδιά σας στο www.pedi.com.cy σήμερα.
I'm actually speechless about this video. I think it is an incredible achievement, and to create a short piece that, like you said, says more than we could say in volumes of work, because you are presenting the work in a short video that we can share around the world. And I do believe it will reverberate around the world to support children's health, and as well as making hospitals safer for people who are sensitive, which is another issue that is critical. Could you talk to us, Dr. Michaelidou, about the reception to this video, where it's being played, and what's happening in the medical community?
Actually, Theodora, thank you very much for the nice work, and I would like also to express my thanks to the actor in the video, Mr. Hamatsos, which actually works on all our videos on voluntary basis. Then about your question, actually it's the first time that this video is broadcasted in this important, very important conference, and we just finished it. And so now is going to, of course, I go to present it through the TV. I try to have a program in the TV presenting this video, and we make also an abstracted form of this, which is very short. It's only 35 seconds or 40 seconds, because most of the channels are not willing to broadcast big videos. So yes, we try, and we put, first of all, we put it's already on our website, of course, and we'll try to disseminate this to all clinics. This is our intention. First of all, through the Pediatric Association, we try to send this to all doctors and pediatricians, but also in other clinics and other hospitals. So trying to make the people to understand and to maybe do the same thing, which is not difficult at the end. I would like to say, because I saw a lot of chats, I cannot respond to them now. I do apologize. I see some nice words. Thank you very much. I don't know whether I can have the chance to respond later. I'm not very familiar with this technology, but anyway, if anybody needs something from me to ask a detail or to ask for a document or whatever, they can join on my email. It's no problem. And my email is also on our website, and Theodora can provide it.
I will put in the chat, when I share the next video, I'll put the links to
the links to the website and to my email. So somebody wants to, and thanks all that express so nicely. I would say that this conference is extremely important and is so well organized, thanks to Lippi, to all involved, and to Ariane. I don't know the other which are behind this organization, all the cooperating organization like Environment and Health Trust and the rest, it is my honor to take part to this and to have the chance to intervene to this. And I learn a lot myself out of this conference, and I think I have the chance to learn more once I watch the lectures that I missed because of this time change. But yeah.
Dr. Michaelidou, could you tell us, and there's a lot of ground because your committee that you are president of has done so much, but could you talk about your collaboration with the Vienna Medical Association and
Yes.
the position paper on 5G? I didn't want to miss this moment without you sharing this work.
Okay, let us start with the Vienna Association. The initiative starts during the end of 2016 when we decided within the committee in cooperation with the Medical Association and the president, Dr. Agathangelu, which I also thank very much for his support and trust, to organize a meeting in Cyprus where we have to inform the doctors about these issues, to raise awareness and to make them familiar with this issue, because most of the doctors, they don't know it because it's not part of their curriculum. So trying to find speakers, I was impressed by the European publication where they provide a very good protocol of how to diagnose, etc., the electrosensitivity. And I contact Piero Lercher, and since then we start our cooperation. He came over to Cyprus. I meet a couple of times also the president of the Austrian Association, Mr. Chekeres. We have a very good understanding and cooperation, and we decided within this, let us say, conference in Cyprus to have something tangible. And we decided to create the declaration for Nicosia based on the experience from other declarations. Of course, it's not that we invent the wheel ourselves, but we try to make it, let us say, and adjust it to the local situation, perceptions, etc. And so we had this declaration of Nicosia, which is being used many times also in the parliament as a very important document. In this declaration, which is available in English on our website, we admit that this issue is not yet fully scientifically resolved. It is evolving. We know that a lot of things has not yet been established, but on the other hand, the documentation, the science that we have till now does not allow us to wait any longer, but we have to act now based on the precautionary principle to reduce the exposure. So the key issue is reduction of the exposure, and we identified 5 reasons why you need to do this. First of all, this EMF radiation is affecting the whole population. It's not only one group, it's not only one city, affecting everyone. So the long-term implications on public health are could be very high. The second is that the people, they don't know the risk. They are enthusiastic about the technology, they are addicted, but they don't know the risk. The third thing is that we have a lot of devices emerging every day. These devices, if it were a chemical, they will never be allowed to circulate in the market.
Right.
Because they never have been tested in terms of health impact, in particular, the long-term impact on children, in particular on children. We don't have enough research so far which is focusing on the children. And we know that the children are more vulnerable. I'm not going to say something which I'm sure everybody in the panel knows very well, and in particular in relation to this radiation, they are even more sensitive because of many other issues in addition to chemicals, which I can elaborate if you like, but I think is known to everybody. So I identified 3 reasons. The 4th reason is that the limits that we have so far are not protective limits, are limits, technological oriented limits, I would say, and they don't consider the actual exposure as it is today, which is every day, 24 hours. The limits are concerning for few hours, for few minutes exposure, 6 minutes exposure. This is what it is written in, at least in the European legislation. So the limits are not protecting us. And 5th reason is that there are very good practices to reduce exposure. Exposure is the issue, not to prohibit technology, which is, let us say, of course, you have to prohibit non-safe technology, but the most important thing is to reduce, to educate the people how to reduce exposure. And this is what the declaration says. And is for the at the political level, the suggestion is that we need to revise the limits and we need to provide the intense incentives for safer technology. And we have to prohibit the wireless technology from the schools. We have to use only the wired, as it is also very clearly stated and explained in the relevant document by European Council Resolution 1815. It's very clearly said and is very clearly explained why we need wired technology in the schools. This is more or less, but you can see all the details of the declaration in our website. And the reduction. Are you going to protest?
Sorry, I didn't want to do that. I was getting it ready. I was teeing it up, and it.
Okay, Deborah. Please let me know when you.
I apologize for interrupting.
No, it's no problem to apologize. In relation to the issue of 5G, there were two meetings at the Parliament, because the Parliament wanted to hear what is the problem. There were on one side those that they push for fast deployment of this 5G, and on the other side there are people, they say no 5G. So they call us, and we went to this meeting together with the medical association. From now, I mean, most of our, let us say, most official work is done together with the Doctors Association. So we think that this is a very good approach, because nobody can say, denies or says what, when the doctors are involved, the things are easier. So in this, in relation to 5G, we make 2 memorandums. You can find it in English again on our website. I would say that we expressed, first of all, our concerns in relation to the missing science in relation to potential impacts on health, because we don't have enough documentation, and we request this documentation. We express our concern because as it is very clearly written in a relevant parliamentary report, a report submitted and prepared for the Parliament in 2019, again is on our website. They are expressing their concerns because we don't have appropriate monitoring approach for 5G, not yet established. How we are going to monitor what the exposure is. And the third and most important is that there is a clear indication, is clearly said in this report as well, that the exposure will be increased, because we have the combination of 3, 4, and 5G, but nobody can tell us what the exposure will be. And the exposure will be even higher and multiplied because of the Internet of Things. And this brings again to what I have said before in relation to the exposure dependence on what we are doing in our houses. And when in our houses we try to use or unnecessary, to my opinion, smart equipment. Last evening I heard examples of refrigerators, of machines, and I saw also the example of pamper, a pamper which has equipment on it to
Diaper, you mean?
warn, yeah, and warn the parent that the children needs to be changed. But you are exposing 24 hours your child's, how I can say, the organs, the
Reproductive.
reproductive, yeah, the reproductive part of his body to this radiation, because you cannot check your child, but the child usually cries when. I have four grandchildren, and I know very well. We give up our, let us say, our autonomy as a mothers. Is it necessary to have this? But the people, they don't know. They have to know that each of these appliances in home will create additional radiation. So coming back to what we suggest in our memorandums, in very briefly, we said that, look, first, we want to have this information regarding the studies, the exposure, etc. But for us, it's red line, the reduction of the exposure now. And we said that from now on, we want that Wi-Fi's were prohibited in schools and probably also in hospitals. And we said that we need to have 5G free zones around kindergartens, playgrounds, schools, and pediatric hospitals. And this free zone for us is a red line, let us say, in our approach, because we think that is very important. And even some claim that the hospital needs this fast internet with 5G, etc. We said that this can be achieved with fiber optics for the hospital, and there's no need to have the 5G, which can also be interrupted, which is not the case with the fiber optics. So this is the one suggestion is in relation to the reduction of the exposure. The second is in relation to the people to have the right to know about all these technologies. And we propose that the government, the Ministry of Health, should support an island-wide campaign. The design of this campaign and the responsibility of the content will be laid on the Medical Association and the Children's Environment and Health Committee, so we don't allow to diluted ideas to be introduced in this campaign. These are more or less what we have proposed in our memorandum, and I think the reduction of the exposure remains the main goal here, through awareness rates, but also through legislative measures for protection of certain areas. We think that 5G could be easily implemented in areas, industrial areas where industrial needs are, maybe in areas where it is essential. We cannot say we don't have any, less competent to say not to use here and there, but we are very clear that we don't want to be used near our children.
Thank you. We are honored that you were able to share this with us for its premiere at the conference. And I will add Dr. Piero Lercher is also on this Zoom if you want to
Yes.
and speak.
Hello.
Hi, Piero. Is my precious collaborator, Piero. Hello, Piero.
Yes, I want to say we really, really, really appreciate your work and would like to thank you, Stella, and also the community in Cyprus, the medical chamber in Cyprus, for all the work you do, your visionary and exemplary work. You did a great, great job. But you also, Theodora, Kelly, and all in the US. It's so great. This conference is fantastic. It's really, let's go on. Yeah,
thank
Stella,
you, Piero. And as I always said, it's not one person's what we achieve. It's little by there, little by here. All of us contributing what we can in our best way that we can. And thank you so much. And I'm honored that I collaborate with all of you. In regards to Dr. Chekeres, please.
Yes, we will greet him. And now we are very proud for this conference. Really, it's so nice. Because
it's so nice.
Cyprus is a small country. Austria is a small country. The United States are big country, big. And that's it's so nice that independent from the country, all we can work together and we can really do very, very important things for the future generations, and we have to proceed in this way.
Yes, and it's just across the world.
Yes.
This video will be shown. The statements on 5G, all of this incredible work that has been done is courageous. It's bringing hope to people where they might feel hopeless, and it's really inspiring both governments and people to take action on this and to do what needs to be done.
Yeah.
I can't be more thankful and honored. Someone asked, can you speak about how the European guidelines are being applied?
The European guidelines are based on the INCRIP, unfortunately, limits. Of course, it is only a guidance, it's not mandatory, but most of the countries, including Cyprus, they implement this. Cyprus is relatively, in a small country, cannot, let us say, deny this, and doing something else is very difficult. But we propose to the Ministry of Health, also it's included in our interventions, I think also in the Parliament, that coming to the children, we propose that their exposure could be evaluated based on biological relevant criteria. As a, let us say, not as mandatory approach, but as an approach which will help to protect the children in the best way, as far as so long those limits are implemented in Cyprus, which are not safe, is the same, more or less the same that you have in the States, unfortunately. There is one tendency from the Green Party in Cyprus. They propose a change of the standards to go at least, if I'm not mistaken, 100 times down. But so far the issue is postponed from one meeting to the other, and we provide, of course, our input on this, and we support this approach. Also, it is accompanying with the new, let us say, guidance on how the installment of the antennas should be in relation to sensitive areas where children are playing or are schools, etc., etc. There are two proposals actually in the Parliament, but since 1 year and a half, we have also now the pandemic, so all the people are concentrated on this. We didn't have any development. And speaking about pandemic, in our website, we decided to install a new, let us say, part of it, which is dealing with COVID-related issues, where we put various information, among which we create a very nice practical guidance of wired internet for the children, because we think those days the children are exposed very much to wireless radiation for distance learning, but and not only, to spend also some time in the house, etc., etc. We have this this very practical guidance in English as well. And again, many thanks to Environmental Health Trust and other sources from where we took all this valuable information, let us say practical. So I think that once again, the key issue is exposure. How we manage. I know 5G is a monster, cannot be fight that easy, cannot stop. But what we can do is to try to make our efforts fine-tuning towards reduce exposure from whatever side is coming in relation to children via awareness and via practical approaches for safe technology. This is, at least this we can manage, we can do this. The other is a fight, is a giant, I would say. I don't know if something can be done in relation to 5G.
It can be done. I believe it can be done.
That's good.
Because
but it will take time.
It will take time, but many hands make light work. And we have people from all over the world on this conference. We have people from all over working together. You know, you're collaborating. I mean, this is possible. I fully believe we'll get there as long as we do this important work and take steps, even if you can't see the whole staircase, as Dr. Martin Luther King said.
Σύμφωνα με τον Παγκόσμιο Οργανισμό Υγείας, η ακτινοβολία που εκπέμπεται από τα κινητά τηλέφωνα, τα Wi-Fi και άλλες ασύρματες συσκευές είναι πιθανώς καρκινογόνα για τον άνθρωπο.
Η τεχνολογία είναι μέρος της ζωής μου.
Γνωρίζω όμως καλά τους κινδύνους της ασύρματης επικοινωνίας.
Και ξέρω πώς να προστατεύω τον εαυτό μου.
Η συνεχής και πολλαπλή έκθεση στην ακτινοβολία αυτή είναι πιθανό να έχει σοβαρές επιδράσεις στην ανάπτυξη και λειτουργία του εγκεφάλου, του αναπαραγωγικού συστήματος, να προκαλέσει καταστροφή των νευρικών κυττάρων και του DNA, απόσπαση της προσοχής, διαταραχές στη μάθηση και άλλες νευρολογικές διαταραχές. Οι κίνδυνοι αυτοί είναι ακόμη μεγαλύτεροι για τους εφήβους, οι οποίοι βρίσκονται σε μια κρίσιμη φάση της ανάπτυξής τους.
Προτιμώ τη χρήση σταθερού τηλεφώνου όταν βρίσκομαι στο σπίτι.
Έχω απενεργοποιημένες τις προσβάσεις μου στο διαδίκτυο αν τηλεφωνώ, όταν παρακολουθώ βίντεο, όταν ακούω μουσική ή όταν παίζω παιχνίδια.
Χρησιμοποιώ ενσύρματη σύνδεση στον υπολογιστή μου για να έχω ασφαλή και γρήγορη πρόσβαση στο διαδίκτυο.
Ενεργοποιώ τις ασύρματες συνδέσεις μόνο όταν είναι απόλυτη ανάγκη και τις κρατώ πάντα κλειστές κατά τη διάρκεια της νύχτας.
Σβήνω πάντα το κινητό μου όταν πάω για ύπνο, το κρατάω έξω από το υπνοδωμάτιο.
Χρησιμοποιώ hands-free και κρατώ το κινητό και άλλες ηλεκτρονικές συσκευές μακριά από το σώμα μου.
Δεν τοποθετώ το κινητό τηλέφωνο στις τσέπες του παντελονιού ή κοντά στο στήθος.
Αποφεύγω την παθητική έκθεση, κρατώντας αποστάσεις από αυτούς που χρησιμοποιούν κινητό τηλέφωνο ή άλλες ασύρματες συσκευές.
Δεν χρησιμοποιώ το κινητό στο αυτοκίνητο, σε ανελκυστήρες ή σε άλλους χώρους με χαμηλή λήψη. Εκεί η έκθεση στην ακτινοβολία είναι πολύ μεγαλύτερη.
Η ζωή και το μέλλον είναι στα δικά μας χέρια.
Ζούμε με την τεχνολογία, αλλά προσέχουμε να μεγαλώνουμε με υγεία. Δώστε στους εφήβους ένα μοναδικό δώρο ζωής, την υγεία τους. Σύμφωνα με τον Παγκόσμιο Οργανισμό Υγείας, η ακτινοβολία που εκπέμπεται από τα κινητά τηλέφωνα, τα Wi-Fi και άλλες ασύρματες συσκευές είναι πιθανώς καρκινογόνα για τον άνθρωπο. Ο πιθανός αυτός κίνδυνος είναι ακόμα μεγαλύτερος για το έμβριο, αφού αυτό αναπτύσσεται καθημερινά και είναι ιδιαίτερα ευάλωτο.
Μία νέα ζωή μεγαλώνει μέσα μου και έχω ευθύνη να την προστατέψω. Έχω ευθύνη να διασφαλίσω ότι το παιδί μου θα αναπτυχθεί σωστά και θα γεννηθεί υγιές. Λαμβάνω σοβαρά υπόψη τις συστάσεις των ειδικών και με απλά και αποτελεσματικά μέτρα προστατεύω το παιδί μου από τους πιθανούς κινδύνους. Περιορίζω σημαντικά την χρήση του κινητού τηλεφώνου και έχω απενεργοποιημένες τις προσβάσεις στο διαδίκτυο. Όταν χρειαστεί να το χρησιμοποιήσω, το τοποθετώ πάντα μακριά από την κοιλιά μου. Χρησιμοποιώ ενσύρματη σύνδεση στον υπολογιστή μου για να έχω ασφαλή πρόσβαση στο διαδίκτυο. Αποφεύγω την παθητική έκθεση κρατώντας αποστάσεις από αυτούς που χρησιμοποιούν κινητό τηλέφωνο ή άλλες ασύρματες συσκευές. Στο σπίτι ενεργοποιώ τις ασύρματες συνδέσεις μόνο όταν είναι ανάγκη και τις κρατώ πάντα κλειστές κατά τη διάρκεια της νύχτας.
Η ζωή και το μέλλον του είναι στα δικά σου χέρια. Έχεις ευθύνη και μπορείς να το προστατεύσεις.
Well, I cannot thank you enough for this incredible work.
Thank you very much. It's my pleasure. And I saw a lot of messages asking of how to have this video. They can simply send me an email and then we arrange what is needed to be done in order to translate it as we do in German, in Israel, and many other countries.
Thank you so much. I'm going to be saving the chat and sending it to you. And as well, we're going to the conference now, which is starting in 2
Yes.
So
Yes. Okay.
goodbye,
Good
everyone.
night, and thank you everybody. Thank you very much. And I wish the best in your domains and in your countries. All together, we manage at the end to protect the children. I'm sure about this. Thank you very much.
Thank you. How long has the committee been running? How long has the Cyprus
From
had?
2004, we established this committee, and I honored to be the president since then. On 2004, when this very important meeting, joint meeting of WHO Environment and Health with the European Union, corresponding environment and health meeting held in Budapest, where they decide that they should be establishment of such committees all over the world in order to take care for preventive actions to protect the children. And at that time, we were lucky because we have a Minister of Health, a woman, which is a friend of mine. And once we came back from this conference, in 1 month, we have established a committee. And this committee is appointed every 3 years by the Ministerial Council. It is an advisory committee. We don't have any executive role. And our mandate, let us say, is to support the policymakers, the regulators, etc., by providing information and documentation on various aspects which affect the children's health. We had a very important role in relation to tobacco smoking. We initiated a project well before legislation came in place to protect the children in home and in cars. And then we work in various fields like face painting, like the lamps, the energy lamps, which are not so safe if they are broken because they contain mercury. Nobody says anything about this. I was part of the Committee on Environment and Share Committee in European Commission, and we issue an opinion on this, working for 2 years, but nothing happens. So we took the initiative and to make a campaign in Cyprus. We issue a leaflet, which is available on our website now. And we try to inform the people what to do with these energy saving lamps, the CFLs, how they have to use them and how they have to clean once we have a lamp broken. So all of this in various fields, and we start working with electromagnetic fields actually from 2011, just after the EARC declaration of potential carcinogenicity, possible carcinogenicity of this radiation. So we decide to work on this issue very, very intensively since then. Mm-hmm.
Thank you for that history. I'm still letting people in. Could you talk more about the work that you've done, the brochures and so forth related to chemicals?
Yes, yes. You see, as I said, we have an advisory role, and adjacent to this is our role to raise awareness and inform the people about the risk for children. And our mandate especially is to ensure that prompt response is taken for risks who are not yet fully established, like is the EMF, but we have strong scientific documentation of potential harm for the children. This is our, let us say, our main target, because if you have a proven, 100% proven and accepted risk, then legislation is coming in place and the things are much easier. But until you reach this point, we need 100 years for tobacco smoking. You remember this. We knew many years ago what would be the impact on health of the population. They do nothing. So we decided as a committee that we have to pay special attention to those areas which are not yet fully established. And one of these is the EMF issue, the RF issue. And since especially 2014, we have established a wide, let us say, campaign. This includes lectures, includes interventions, includes political interventions, but also we issue a lot of leaflets and videos like the ones you see today, in trying to inform the wider population about the risk. Because from the very beginning, we identified as a target area homes and schools, because if you estimate how long a child, how many hours it spends in home and school, depending on its age, from the kindergarten school till the lyceum, for instance, then it is 60 to 90% for the smaller kids, they are spending in house and in schools. And if we try and we manage to have reduced exposure in these two areas at the beginning, and we make also the parents to be aware and demand safer technology options for their children at the end, then it will be, let us say, we achieve a certain degree of protection of the children from the exposure. Because, to my opinion, is the greatest exposure happens in homes, because not only from the antennas, of course, if they are very close to the homes, we have this impact, but nevertheless, to my opinion, the biggest problem is the wide usage of wireless technologies in home. If we manage to switch off Wi-Fi and persuade the people that they have the option to connect wired, advise them how to use their mobile phones so they activate anything which is not in use. Most of the people, they use to have their mobile phones to make a call, and they have mobile data on, Bluetooth on, Wi-Fi on, everything, which is not really needed. And to explain to the people that you can use your mobile phone for entertainment if you like, for your children, for a certain period of time, put it in a flight mode, deactivate all the antennas, and then you can use pre-downloaded, the downloaded material, music, videos, etc., etc. So we put a lot of emphasis in this area, Theodora and my dear colleagues. And then we also identified the issue of how important is to reduce the exposure in hospitals, in pediatric units, especially in units of intensive care units, in neonates units, and in units with children who suffered from cancer. So, and this was the newest project that we, in parallel, we continue all the activities. I can give more information of what we have done so far, what we have achieved, not many, but at least we move a little bit. And so we decided at the end that we have to try a project in the hospital. In Cyprus, the Makarios Hospital is the main pediatric and mothers hospital. It's combination. It includes both. So this is the most, let us say, the most, in terms of expertise, the most important pediatric unit that we have in Cyprus. And I was lucky that we have doctors which are very sensitive, because we tried for the beginning to establish very good links with the medical associations and the medical doctors. So I've been invited in their seminars, annual seminars, and we provide this source of information for the doctors. And we are working very closely. Actually, we have 4 doctors in my committee. One is the president of the Pediatric Association, which unfortunately couldn't join us because he has another meeting the same time. So, and we try to influence the doctors because, first of all, the doctors are the most trusted and respected by the parents. So they can influence parents. And I know doctors that advise their clients once they enter their offices to switch off their mobile phones, to put it on flight mode, and explaining a little bit, and not allowing, of course, to see children carrying their mobile phones with them, because it's unfortunately, this starts from age of 5, of 6, of 7, right. Unfortunately. So, and then we discussed first with these 2 doctors, is Andreas Sergis and Adonis Kleanthous. I have to mention their names because, let us say, we dream and design this project together. And then we go to the directors of the Makarios Hospital, which I knew before, and they knew our work as a committee. So I would say that we are trusted in Cyprus, that we always provide science-based information, science-based awareness-raised campaigns, etc. So we went and we speak with Dr. Neophytou, which is executive director, appearing also in our video, and Dr. Abraham Ilia, who is the director of the pediatric unit. We explain what we intend to do, and they give all the support that we could have on this. So, and I would like also to mention something which is a little bit personal, but I feel I have to do. At the initial stage, I supported also on from my private initiative, this project in the memory of my husband, Polis, who dies from leukemia. So we give a push to the project so we can start, and now it is moving. What this project is first of all, it's a campaign. On one hand, we try to inform the doctors, the nurses, and the parents in the hospital. We make some lectures, we provide leaflets, we provide brochures, and I'm grateful to Theodora and Environmental Health Trust and Debra for allowing us to use some of the material. You will see one appear also in the project. And we try to inform the people and to persuade that, look, we have to deactivate the Wi-Fi's, and we have not to use mobile data and mobile phones in this area of the hospital. And the first reaction was a lack of resisting approach, especially from the nurses. They want to have their mobile phones, they are used to use them. They say, how can be connected if we want to have some information? But we said, we are deactivating Wi-Fi, but we provide you a wired internet. And we provide computers for the staff there so that they can use the Ethernet, not using their mobile phones. Well, at the beginning it was difficult. And this is because the people do not know. But finally, we said, okay, we are going to make also measurements here to prove to you what is happening. So we have collaborated with Dr. Metsis. I don't know, Theodora might know him, from Greece, which is a specialist in this issue of measurements, electromagnetic fields. And he came in Cyprus, and actually he offers voluntary his services for this project. I thank you very much, him. So we make measurements before, as the situation was with Wi-Fi's, with mobile phones, etc. And then we remove the Wi-Fi's and to make again measurements. And I can provide some details on results if you are interested. But what has been proved is that the Wi-Fi creates a very strong passive and active exposure. Passive to everybody, which were up to a distance of 10 meters from the router, and active exposure to those who are using the Wi-Fi to download videos. And we make a comparison by downloading video with this Wi-Fi, and then we download the same video using the Ethernet. And at the end, also, we download the same video using the mobile phone. And what we find, I think I can give some indicative values to see what it is. So we see that the passive exposure up to 10 meters with directional antenna is raising up to 20,000 microwatt per square meter. When somebody is downloading a file, a specific file with Wi-Fi on his laptop, his exposure reached up to 26,000 microwatt.
So you saw you were able to not only reduce, you know, replace it, but to show that what you were doing
We show
made a
them.
difference.
And when they do the same job with our mobile phones, the levels reach 190,000 microwatt per square meter for the same file. And when we disconnect Wi-Fi, close mobile data, and you download exactly the same file in front of all this personnel, the same file with the Ethernet, we only find 56 up to the maximum, which more or less is the background also radiation. It's not coming from the Ethernet, but this was below the 100, which is considered, let us say, in quotations as safe according to Europe-IM for daily exposure. So it was very clear, extremely important to show the people that we are not saying something because we think, but because it is a fact. From there so on, the project moved smoothly, and we finalized and we managed to have this very extremely important healthy environment for the children in the prenatal unit, which is very important, in the school of the hospital, and also in the intensive care unit. And we explained to the people that the radiofrequency radiation and the impact on the children is not compatible with the aim of the hospital, which is to heal and to recover those children. And of course, we know that in those neonatal units and intensive units, and also the seriously ill children, have to go through many examinations where radiation is used because it's essential for their life. But we said it's not acceptable to add unnecessary exposure to the already sometimes high exposure of those children. We explained this to the doctor, and I think they start to understand why is this the problem. And we speak also about other issues in relation to the immune system, and for the children who have problems with their immune system, especially the children going through chemical treatments and so on and so forth. And we said that it is documented that the immune system is affected. So we have to do something. We have to protect the children. We have to reduce unnecessary exposure. We said, and some people claim, but radiation is everywhere. We have the antennas and so forth and so far. Of what we experience in the Makarios Hospital, because of the let us say lucky location of those antennas, it is that the contribution to the exposure from the antennas was relatively small in the hospital. It was not the one who determines the exposure. Wi-Fi and mobile phones are the ones who create the exposure in the hospital. So, and of course, some other necessary, let us say, equipment. We want to advise people on sustainable solutions, not something which cannot be implemented. We accept anything which is necessary for the treatment of the children, but we don't accept as a principle, as a matter of principle, to unnecessarily expose the children to this radiation. This is more or less the issue in relation to this Makarios project. And hopefully when I go back, we try to go to other units of the hospital one by one to see how to what extent we can provide this good environment. Of course, we have a lot of reactions from many sides, as you can understand, but we said, whatever we said, we sent documentation to the hospital. We said the literature on which is our let us say suggestions is based, etc., etc. And so I think I hope that we manage to continue.
Well, thank you so much.
Τα παιδιά μας εκτίθενται καθημερινά σε ένα ηλεκτρονικό νέφος, το οποίο δημιουργείται από την ακτινοβολία που εκπέμπουν τα κινητά τηλέφωνα, tablets και οι συνδέσεις μέσω Wi-Fi και άλλα παρόμοια. Η ακτινοβολία αυτή, σύμφωνα με τον Παγκόσμιο Οργανισμό Υγείας, είναι πιθανώς καρκινογόνα για τον άνθρωπο. Σύμφωνα με νεότερες έρευνες, η ακτινοβολία αυτή είναι πιθανό να προκαλέσει και άλλες σοβαρές επιδράσεις στην ανάπτυξη και λειτουργία του εγκεφάλου, του αναπαραγωγικού και άλλων συστημάτων του εμβρίου και του παιδιού, να προκαλέσει καταστροφή των νευρικών κυττάρων και του DNA, διάσπαση της προσοχής, διαταραχές στη μάθηση και άλλες νευρολογικές παθήσεις. Τα παιδιά είναι πολύ ευάλωτα. Μπορούμε όμως σε σημαντικό βαθμό να τα προφυλάξουμε από ένα σοβαρό κίνδυνο. Φτάνει να μάθουμε πώς.
Αφού μας αγαπάτε, γιατί μας ακτινοβολείτε με τα Wi-Fi και τα κινητά σας τηλέφωνα? Έχουμε δικαίωμα στην υγεία και πρώτοι εσείς μπορείτε και πρέπει να μας προφυλάξετε.
Στη βάση της αρχής της προφύλαξης, το Συμβούλιο της Ευρώπης, το Ευρωκοινοβούλιο, επιστήμονες, ιατρικοί και εκπαιδευτικοί σύλλογοι στην Ευρώπη συμβουλεύουν ότι θα πρέπει να μειωθεί η έκθεση των παιδιών στην ακτινοβολία που εκπέμπουν τα κινητά τηλέφωνα, tablets και οι συνδέσεις μέσω Wi-Fi, ιδίως στο σπίτι και στο σχολείο.
Η έκθεση των παιδιών σε ηλεκτρονικό νέφος εγκυμονεί κινδύνους. Η χρήση των κινητών και συσκευών Wi-Fi από παιδιά μικρότερα των 14 ετών πρέπει να αποφεύγεται. Προφυλάξτε την υγεία και το μέλλον των παιδιών σας. Το ίδιο ισχύει και για την έγκυο. Οι έφηβοι ποτέ δεν βάζουν το κινητό στο υπνοδωμάτιο τους, στις τσέπες τους, στα μπράτσα ή κοντά στο στήθος τους. Πάντα χρησιμοποιούν hands-free και κρατούν το κινητό μακριά από το σώμα τους.
Αξιοποιώ την τεχνολογία σωστά. Γνωρίζω τους κινδύνους και δεν εξαρτώμαι από αυτή. Χρησιμοποιώ ενσύρματη σύνδεση για τον υπολογιστή του σπιτιού μου και ενεργοποιώ το Wi-Fi και τα δεδομένα κινητής τηλεφωνίας μόνο όταν χρειάζεται και ποτέ όταν τα παιδιά μου είναι κοντά. Δεν χρησιμοποιώ κινητό τηλέφωνο στο αυτοκίνητο όταν τα παιδιά μου βρίσκονται σε αυτό. Η έκθεση στην ακτινοβολία είναι πολύ μεγαλύτερη. Προστατεύω πάντα τα παιδιά μου.
Η Γαλλία ήδη με νόμο απαγόρευσε τη χρήση Wi-Fi σε παιδικούς σταθμούς και σε χώρους όπου φιλοξενούνται παιδιά κάτω των 3 χρόνων. Επιτρέπει ελάχιστη χρήση στα σχολεία κάτω από αυστηρούς περιορισμούς.
Στον υπηαγωγείο, στο σχολείο και στο σπίτι περνάμε τουλάχιστον το 75% του χρόνου μας.
Απαιτούμε ασφάλεια χωρίς ακτινοβολίες από Wi-Fi, κινητά και άλλες ασύρματες συνδέσεις. Η υγεία είναι δικαίωμα. Μην μας το στερείτε.
Δεν έχουμε το δικαίωμα να ρισκάρουμε την υγεία των παιδιών μας αναμένοντας παθητικά τους άλλους να κάνουν κάτι. Ας ξεχάσουμε τι είναι βολικό για μας και ας τους χαρίσουμε το καλύτερο δώρο, την υγεία τους, μετατρέποντας το σπίτι και το σχολείο σε όαση προστασίας.
Το σπίτι μου είναι όαση αγάπης και ασφάλειας. Σβήνω τα Wi-Fi και άλλες ασύρματες συνδέσεις όταν δεν χρησιμοποιούνται και κυρίως όταν τα παιδιά είναι στο σπίτι και τα κλείνω πάντοτε το βράδυ. Αξιοποιώ το κουμπάκι on-off. Είναι τόσο απλό να μειώσω το χρόνο αχρίαστης έκθεσης. Επενδύω στην υγεία των παιδιών μου μακροχρόνια.
Η ζωή και το μέλλον τους είναι στα δικά μας χέρια. Δώστε στα παιδιά ένα μοναδικό δώρο ζωής, την υγεία τους.